Hello, I'm Brad Hayden, and today we're going to discuss the decline of tuberculosis during the period of the Industrial Revolution. So, to begin, let's discuss what tuberculosis actually is. This disease is caused by the bacteria Mycobacterium tuberculosis, which usually attacks the lungs of its human hosts. However, TB, as it's commonly called, is not spread through direct contact or exchange of bodily fluids. Instead, TB is commonly spread through the air by means of coughing, sneezing, or speaking. Common symptoms of TB include bad cough, chest pain, and weakness or fatigue. If left untreated, it can lead to death, as we've seen in past encounters with the disease. However, during the 18th and 19th centuries, during the period of the Industrial Revolution, we begin to see a change, as new innovations combat the effects of tuberculosis. Improvements in farm machinery, fertilizers, crop rotation, seed selection, and methods of food storage allow for greater food production, with McNeil estimating that British agricultural production rose by about 33% or one-third during the span.
These advancements, along with the utilization of new American crops such as maize and potatoes, would support massive population growth, changing the way that TB affected our world. Since farmers could now grow more with far less workers, there's a great amount of displaced labor during this point. The majority of these displaced workers would flock to the large cities, where many of the remaining jobs now resided. This would lead to a massive amount of urbanization, which would have a couple of effects on the spread of tuberculosis. At first, this causes a decline in TB rates. Bovine tuberculosis, which resides in cattle, can infect humans and morph into the human form of tuberculosis. Thus, as workers move to the city and therefore come in less contact with cattle, this reduces the spread of TB. However, we do see a resurgence in the disease in the early 20th century as these cities quickly become dirty and overcrowded. In addition, the increased use of enclosures helps limit the spread of bovine tuberculosis during this period. As more farmers used private pastures to house their cattle, chains of infections between herds were broken up. This practice limited the spread of TB in 18th century Great Britain, where it was especially prevalent. However, as McNeil notes, this was not the case in France, as private enclosures did not become commonplace until later in the 18th century. As a result, peasant health suffered, and TB remained a very serious health problem. Back in the rural areas, growers began to use turnips and alfalfa as large-scale feed for cattle, which allowed them to be healthier than they were in previous times. This led to an increased amount of meat and dairy products in our diet, and, as McNeil theorized, increased production of antibodies, which may have raised our general resistance to infectious diseases such as tuberculosis. Finally, and perhaps most importantly, the secularization and organization of medical practice were vital in helping to combat tuberculosis during this time period. During the Industrial Revolution, medical professionals began to better understand how various diseases were transmitted, as well as test and document which treatments were most effective in treating these diseases. This development led to a number of practices that were used to combat tuberculosis. Practices such as quarantining those infected with TB in sanatoria, slaughtering cattle infected with bovine tuberculosis, and prohibiting spitting in public places were all used to help combat the disease. Greater breakthroughs were soon to come, as in 1882, Robert Koch discovered the causative bacillus for TB, and in 1921, a partially effective vaccine was developed. However, tuberculosis is still a problem today. Because the bacteria is ever evolving and has become resistant to some forms of antibiotics, we're having a harder time of fighting it than ever. In 2015, the World Health Organization stated that 10.4 million people became infected with TB during the year, with 1.8 of those people dying from their exposure. Though Dr. Satcher has stated that infectious disease is no longer a problem to us, it's clear that we still have some work to do to combat tuberculosis. With that, I'd like to leave you with one last question. Will we ever completely eradicate infectious diseases such as tuberculosis? If so, what do you believe are the most effective ways of combating them?